is the president and owner of Balanced Health and Wellness Centers in Lexington, Kentucky. She is a board-certified internist and board-certified and fellowship-trained in anti-aging, functional, regenerative medicine with over 10 years of clinical experience. In addition to running her solo practice full-time, she is also the medical director of Seasons Salon and Spa and the health and wellness columnist for Business Lexington, a prominent local business publication. She is also actively involved in teaching, writing, and speaking on topics related to anti-aging, health, and wellness. Her special interests are bioidentical hormone replacement and adrenal gland dysfunction. May's issue of Kentucky MD News Magazine highlighted her unique and progressive anti-aging medical practice to Kentucky physicians statewide. It's my pleasure to introduce Dr. Lena Edwards.
Good morning. Good morning. We're going to start our Friday eye-opener, it's Friday, right? With a nice non-controversial topic. So as you're all increasing your cortisol levels drinking your coffee, we're going to discuss whether or not this concept of adrenal fatigue that so many of us use as far as terminology is concerned, whether patients or physicians. I would like to talk to you today about the entire concept of adrenal fatigue and ask you to consider, after my discussion is completed, broadening your horizons a little bit. And so, they showed me how to work this. Let's see if I remember. Okay. So I think before we get started, there's a few platforms I'd like to set. And the first one is, I think, the definition of adrenal fatigue. What exactly does that terminology include? What does it mean? And drawing from a few different sources, basically the concept of adrenal fatigue is a maladaptive state in which the adrenal glands lose the capacity to produce stress hormones and to properly mount an appropriate stress response, not only as an acute response, but more so in the face of ongoing and chronic repeated stressors. So basically, the adrenals simply cannot keep up with the stress that's placed upon them. Now, I will submit to you the following reasons that I believe that this particular terminology does not do justice to the stress response system overall. First of all, it truly does not describe the adequate and accurate pathophysiology by which low adrenal states, or low cortisol states rather, actually arise. Secondly, through my review of the medical literature, which has been quite extensive, I'm writing a book, and I've also got some articles coming in publication. So I'm fairly familiar with the literature, and quite honestly, there have not been any evidence-based reviewed articles or any sorts of literature actually substantiating the presence of true adrenal gland exhaustion in the presence of just pure stress. And again, by the time I give you this brief discussion, I hope you will understand that the nature of the stress response is extremely complex, and there are many different areas at which the dysfunction can arise. Someone's dancing out there, that's either good or bad. Okay. Feel free to chime in, this is an eye-opener, so just the front half of the room is full. And I'm sure that some bodyguard is supposed to be here for me today. All right. Now I'd like to talk about the historical perspective. How did the terminology even come to fruition? How did people even understand the concept of stress, and when did it arise? Well, these would be sort of described as the forefathers of and the pioneers of the stress response and the concept that stress actually induces disease. And Thomas Addison was perhaps the first pioneer in this field, and hence the term Addison's disease, which describes a complete lack of cortisol production by the adrenal glands. Now, in 1903, Dr. Sajou is the first one who actually imported the term hypoadrenia from Europe. And the terminology he used basically was to describe adrenal exhaustion as a result of strain and labor. So primarily in response to physical stimuli. And he actually developed 3 different stages of what he considered to be hypoadrenia. And one of them was called functional hypoadrenia, which would then progress on to progressive hypoadrenia, excuse me, finally resulting in what he considered to be terminal hypoadrenia, which there was complete exhaustion of the adrenal glands. However, in all of those different stages, the response of the adrenal gland was, and the lack of the cortisol production at that particular point, again, was in response to some physical stimuli, an infection, physical labor, and things of that nature. Dr. Cannon, also very important, coined the whole concept of fight or flight. But perhaps the most important figure, and the person who's considered actually the father of stress, was Hans Selye. And I'm sure that all of you have heard this particular individual's name in some capacity. I'm trying to figure out how he had time to write almost 2,000 articles in his lifespan. But he did it, and he promoted and contributed a significant amount to our understanding of stress. And probably the thing that he is the most well known for is the concept that he adapted called the general adaptation syndrome. And again, most of you have probably heard about this in some respect if you're dealing with people that have stress, and if you've heard the term adrenal fatigue, because you want to understand where it comes from. And so Dr. Selye came up with the general adaptation syndrome, and again, 3 different responses, 3 different phases of that response. The first phase, of course, would be the alarm stage, where, oh my gosh, I'm getting ready to run into the back of this car. The second stage is the stage of resistance, and that's basically where your body adapts. It realizes that there's a stressor, and there's an adaptation response that then ensues, and then everything is supposed to then regain normality, and everything is supposed to go along just fine. However, if that does not happen, eventually a stage of exhaustion will occur, and at that point, all of the bodily systems are exhausted. Now, again, the important thing here to realize is that all of these physicians and other contributors to the stress response and the concept of stress understood that the stress response system was multifaceted, and there was not just one system at play. The immune system was involved, the central nervous system was involved, and there were a lot of other things that I don't think they realized at the time that we now better understand, although our knowledge is still quite lacking when it comes to the stress response system and the level of complexity. So I want to really do as good a job as I can explaining to you what is involved in the stress response system, what components are involved. Why is it that when you see a patient with low cortisol, sometimes they don't feel that bad? Or sometimes you see someone with a normal cortisol release pattern and they feel horrible. That doesn't make sense. Or you'll give them a glandular or an adaptogen and you're not getting the expected treatment outcome. And hopefully, this discussion will give you a better idea of why perhaps you see those things in your practice. Now, really what we're talking about primarily is the adrenal gland hormone cortisol. Equally important is the adrenal gland hormone DHEA, which I will not get into right now, but there is a well-recognized condition as we age, everything pauses, and the adrenal glands go through adrenopause, which is primarily a reduction in the level of DHEA as we age, and you see things like osteopenia and sarcopenia. Okay, so that's not disputed, even in the conventional medical literature. But when we're talking about cortisol, really the key is, if you're going to have a discussion with your spouse, this will always get so much attention. Okay? So when I have a discussion with my spouse, I'm the alpha female. You probably all figured that out by now. So it's either my way or the highway sometimes. But it really depends on the communication that we have between us and how the conflict is going to be resolved. So how is the message getting through? First of all, is it getting through? How much of the message is getting through? You know, is the TV on, the football game's on, and you're sort of getting listened to, but you're sort of not, and there's miscommunication in the translation behind what you said. So all of those things come into play when you're talking about whether or not message A gets through and produces result A. So when we're talking about glucocorticoid signaling, in order for the glucocorticoids to promote survival, they have to mobilize the body's resources. So there's a stressor, cortisol goes up. Okay, now we have to divert everything of importance into survival. Reproduction, sleep, things of that nature don't matter. Okay? And then eventually you have to adapt to that stress. And our bodies weren't designed to withstand and to be exposed to chronic stressors. So we've adapted in a very dysfunctional way, hence disease and aging, and the fact that alcohol sales are up really high. And so we self-medicate with all sorts of things to make ourselves feel better in the short term, which just simply adds to the stressors on our system long term. So, sorry, the timer's not on, so I'm just going to keep timing. I still have 21 minutes. So anyway, then you have to make sure that there's enough cortisol present. The bioavailability of the cortisol, the tissue responsiveness of the the cortisol. All of those things are going to matter when you're looking at someone trying to determine what you're going to do with their salivary cortisol release pattern that you just obtained. So really, in my mind, the fundamental question is the message getting through? Okay? You can have cortisol there and the message might not get through at many different levels. And I'm going to show you some examples of where the breakdown in the system can occur. I also want to complicate things a little bit further for you by telling you that all of the stress responses that we mount as human beings are affected by our genetic makeup, our developmental factors. They've been shown now that things in utero can affect an adult stress response system and their cortisol release patterns once they become adults, and their ability to withstand recurrent stressors once they've experienced stress in utero and in childhood, traumatic situations. Gender, women are more high strung, I guess, than men are, because the literature would suggest that we have more issues with our stress response system than do men. Age makes a difference. So there's all of these other factors that will influence whether or not my cortisol curve goes up and my husband's cortisol curve doesn't. Those all will play